Hi, when you approach a root canal, in the preparation techniques, there are three things that have to be kept in mind. First being the length, second being the diameter, third being the taper. You have no choice on length because you have to reach till the apical end, the minor diameter, the prescribed place that you want to be in. Diameter is the second important point, where also you have less of a choice. The minimum prescribed diameter is 25 in most of the books. Third option is the taper. What is a taper? Taper is nothing but a flare. From the midline, how much will it shift on either side, the cone as it spreads? Imagine an example in this picture. In this diagram, you have a size 20 file explained. A 20 size file, after every millimeter, is going to jump by a size 2. So at 1 millimeter, it's going to be a size 22. At 2 millimeter, it's going to be a size 24. And at 3 millimeter, it's going to be a size 26. This can go on with the old ISO standardization, which means generally when you prescribe for an instrument or buy an instrument of a 2% tapered, the working end or the flutes are about 16 millimeters. But today, when you say greater tapered, any taper above 2 is a greater taper. So you can have a 4%, a 6%, an 8, 10 or a 12. The same rule of 16 millimeters now may not hold good. When you have a file above 8, 10 and 12, when you add 12 to every millimeter of even the smallest file, when it reaches the 10th millimeter, possibly the width of an instrument is designed. Also, to explain a 2% taper, 2% taper is nothing but O2 taper or 2 by 100. Different books have explained differently. I also would give you a picture about this, saying that a maximum shank diameter of any root canal file should be a size 120, and there are no root canal files beyond that. So in a 12 tapered, it's only a 10 flutes that you will get, because you'll reach 120 by then. Okay, coming back to the length, diameter and taper, I said length you have no choice, diameter you have less choice, taper you have all the choice. Having said that, 2% is not a taper, it's a parallel instrument. It's a non-tapered instrument in a tapered canal, and root canals are always tapered. So what I want you all to understand is, at least land up with a 4% taper. I would prefer a 6 to an 8% taper. After preparing that, what you need to understand is how well have you prepared the apical end, because the zone of infection is always at the last 3 to 6 millimeters, and that also decides how well you've got a cone fit. With the newer preparations, you end up getting a good cone fit or a snug fit. What is a snug fit? Snug fit is nothing but, because of the conical preparation, you end up getting a linear resistance form. Earlier days we talked about tug back. Tug back was a point resistance form, which was not as much appreciated. When you get a linear fit on the master cone, that's known as a cone fit. But when it comes to a cone fit, what you need to understand is the last 3 to 6 millimeters is what you will design a master cone. In one of the next videos, possibly I'll speak about apical gauging, where you can select a master cone to the right prescribed diameter. Thank you.